Overview of diabetes and vascular complications. The incidence of diabetes is reaching epidemic proportions worldwide, spanning across all ages, ethnicities, and genders.
Accounting for nearly 20% of healthcare dollars in the United States, diabetes is the leading cause of blindness, kidney disease, lower extremity amputations, and is the seventh leading cause of death, killing more individuals than AIDS and breast cancer combined.
Currently, 1 out of 10 Americans are diagnosed with diabetes. However, according to the World Health Organization, the diabetes epidemic will continue to grow without primary prevention and cost-effective treatment strategies, increasing to nearly 1 out of 3 diagnosed Americans over the next 4 decades.
Let's start with the basics.
Diabetes is a collection of heterogeneous endocrine diseases that share a common phenotype, impaired glucose tolerance. Clinically, diabetes is divided into 2 etiopathogenetic categories, type 1 and type 2. Type 1 diabetes is characterized by absolute inability to secrete insulin, whereas type 2 diabetes is a combination of insulin resistance and impaired insulin secretion. Unlike type 1 and type 2 diabetes, gestational diabetes has no known causes, however, displays similar symptoms and clinical manifestations as type 2 diabetes. These similarities include insulin resistance, increased urination, and excess glucose in urine, and increased thirst.
Nevertheless, both symptoms and clinical manifestations typically disappear in patients with gestational diabetes following delivery.
However, since neither type 2 diabetes nor gestational diabetes are insulin deficient, they are less likely to experience the classic symptom of uncontrolled hyperglycemia, ketoacidosis, as evidenced in type 1 diabetes, which
is defined clinically as plasma glucose level greater than 250 mg per deciliter, plasma bicarbonate less than 15 milliequivalents per liter, arterial pH less than 7.35, increased ketone production, and elevation in the anion gap, greater than 10 milliequivalents per liter. At the center of each of these pathologies is the clinical characteristic of hyperglycemia. Clinically, hyperglycemia is when fasting blood glucose is greater than or equal to 126 mg per deciliter, and is the consequence of insulin resistance, insulin secretion, or both, resulting in the inability to efficiently utilize glucose.
The significance of protecting the body from hyperglycemia cannot be overstated. However, it is important to remember that diabetes is a disease of altered metabolism and chemistry of both carbohydrates and lipids. The deleterious effects on the human vascular tree that follow are divided into 2 classifications: microvascular and macrovascular.
Diabetic microvascular complications include nephropathy, neuropathy, and retinopathy. And macrovascular complications include coronary artery disease, peripheral arterial disease, and stroke.
For this reason, pharmacological and lifestyle therapies have aimed at managing hyperglycemia in order to prevent and reduce these costly and severe secondary complications.
As the prevalence of diabetes continues to increase at an alarming rate, it is important for medical practitioners, from all disciplines, to understand the relationship between diabetes and vascular diseases in order to work together in developing interventions that help identify and treat these complications effectively.
Since type 2 diabetes is responsible for nearly 90% of all diagnosed cases of diabetes, 90% of economic burden, and complications are preventable through lifestyle modifications, going forward, this material will focus specifically on type 2 diabetes and the mechanisms that mediate tissue damage, inside and outside the cell. The end of Overview of diabetes and vascular complications. This is one of 3 videos. For additional information, watch the video titled Advanced Glycation End Products and the Pathophysiology of Angiopathies in Type 2 Diabetes, or the video called Dietary Advanced Glycation End Products. This information is also available at the provided URL.